patient comes in for a routine ECG. No chest pain, no shortness of breath, nothing dramatic. But when you look at the ECG, something feels off. The QRS complexes look slightly abnormal. The axis seems shifted, and yet everything else looks almost normal. This is easy to miss, easy to ignore. But this subtle finding could be telling you something important. This is a fascicular block, a conduction abnormality hiding inside the left bundle branch. And today, we're going to break it down so you can recognize it instantly. Fascicular blocks are a type of intraventricular conduction delay. They occur when one of the divisions of the left bundle branch fails to conduct electrical impulses properly. To understand this, we need to quickly revisit cardiac conduction anatomy. After leaving the atrioventricular node, the electrical impulse travels down the His bundle. It then divides into the right bundle branch and the left bundle branch. The left bundle branch further splits into two main fascicles, the anterior fascicle and the posterior fascicle. Each of these pathways carries electrical impulses to different regions of the left ventricle. When one of these fascicles is blocked, the electrical signal is forced to take an alternate route, and this changes the direction of ventricular depolarization, which is exactly what we see on the ECG. There are two main types of fascicular blocks: left anterior fascicular block and left posterior fascicular block. Let's start with the more common one. In left anterior fascicular block, the anterior fascicle is blocked, so the electrical impulse travels down the posterior fascicle instead. From there, it spreads upward and leftward across the ventricle. This creates a characteristic left axis deviation, and this is the key to diagnosis. On ECG, left anterior fascicular block has three classic findings. First, left axis deviation, typically between -45 and -90 degrees. Second, small Q waves with tall R waves in leads 1 and a VL. And third, small R waves with deep S waves in leads 2, 3, and a VF. The QRS duration is usually normal or only slightly prolonged. So if you see left axis deviation without a wide QRS complex, think of left anterior fascicular block. Now let's talk about left posterior fascicular block. This one is much less common because the posterior fascicle has a dual blood supply and is more resistant to damage. In left posterior fascicular block, the posterior fascicle is blocked. So the impulse travels down the anterior fascicle and then spreads downward and rightward. This results in right axis deviation. The ECG findings are essentially the opposite of left anterior fascicular block. You will see right axis deviation. Tall R waves in leads 2, 3, and a VF, and deep S waves in leads 1 and a VL. Again, the QRS duration is usually normal, and importantly, you must rule out other causes of right axis deviation before making this diagnosis, such as right ventricular hypertrophy or pulmonary disease. So what causes fascicular blocks? They are often associated with structural heart disease. Common causes include ischemic heart disease, hypertension, aortic valve disease, and cardiomyopathies. They can also be seen in degenerative conduction system disease, especially in elderly patients. Left anterior fascicular block is often benign, but it can also be an early marker of underlying cardiac pathology. Sometimes fascicular blocks occur in combination with other conduction abnormalities. For example, a right bundle branch block combined with a left anterior fascicular block. This is known as a bifascicular block, and it increases the risk of progression to complete heart block. So recognizing these patterns is clinically important. Most patients with isolated fascicular block are asymptomatic. The finding is often incidental on ECG, and in many cases, no specific treatment is required. Management focuses on the underlying condition. If the block is due to ischemia, treat the ischemia. If it is due to hypertension, control the blood pressure. If multiple conduction abnormalities are present, closer monitoring may be needed. So let's summarize. Fascicular blocks are conduction delays within the left bundle branch. There are two main types: left anterior fascicular block, which causes left axis deviation, and left posterior fascicular block, which causes right axis deviation. The QRS complex is usually normal in duration, and the diagnosis is primarily based on axis changes and specific ECG patterns. These are subtle findings, but they matter. because sometimes the smallest ECG changes reveal the biggest clues about the heart. If you found this helpful, make sure to like the video and leave a comment below. Tell us which ECG topic you want next. We read your feedback closely, and it directly influences the future content. And don't forget to subscribe and turn on notifications so you never miss an upload. We have a whole series of ECG interpretations for every ECG rhythm out there. Thank you for watching, and we will see you in the next video.